welcome to Ames Responds to COVID-19, a question and answer program where Ames area organizations respond to COVID-19 questions. I'm Susan Guiesta, Public Relations Officer with the City of Ames. My guest today is Erin Rosacker with the Iowa State University Office of Strategic Relations and Communications. The City of Ames, along with several other local organizations, is partnering with Iowa State University on a county-wide public health campaign called Cyclones Care. The entire campaign focuses on 4 pillars of healthy decision-making. Initially, Iowa State University developed Cyclones Care for the university community, but it has attracted followers far beyond campus. We'll spend today's episode of Ames Responds talking about this new public health initiative. Erin, welcome to the show.
Happy to be here.
So talk to us a little bit more about Cyclones Care, the thought process behind creating it, and who are the experts involved in its creation?
Sure. We have a lot of cooks in this kitchen, as you can imagine. So with the return to on-campus operations in the fall, the planning process included promoting these 4 healthy behaviors through a central and very consistent messaging campaign, so that no matter where you went on campus, you would see it and hear the same message the same way, no matter where you were. And for this project, we pulled together a team of campus experts. So that was communications, behavior change, student affairs, and others. We've involved writers, graphic designers, photographers, videographers, student health professionals, faculty experts, and students. All of them have been involved some way down the road. We've had incredible participation from just about every corner of campus and beyond now. We looked at what some other institutions were starting to do because, we really got underway at the end of March, probably beginning of April, and we've gone so fast, so far, so fast. It's like, it's unreal, especially at the university. It takes a long time to get something that's going, but we, of course, needed it yesterday. So here we are. And we came up with 3 different ideas for this campaign, took it to top administrators, and they narrowed it down to what they liked, what they didn't like, and ta-da, Cyclones Care is born.
So tell me about the 4 pillars. What I love about Cyclones Care, and I think what has drawn in so many other organizations, is its simplicity and message. So
absolutely, yes.
About the 4 pillars of healthy behavior.
Yes, so super easy. Physical distancing, wearing a face covering, wash and sanitize your hands often, and stay home when you're ill. Doesn't get much more easy or common sense than that. Anybody can understand that language.
And one of the things we had talked about earlier is that the behavioral specialists had talked about the idea of getting away from the stop, no, never idea, and instead focusing on the how-to, what's expected, the more positive side.
Absolutely. So we are not about scolding or demanding. So nobody wants to be told what to do or scolded for not doing something. We really do care, like the campaign says, Cyclones Care. We really do care. And the language we use is very intentional. For the signage especially, we have basic, fairly general language that keeps the informational. So no matter, you can read it when you walk by, all 4 behaviors. It's short, digestible, and you can adapt it for multiple uses. So we say, wear a face covering. Well, a face covering can be a cloth face covering, can be a paper face covering, can be a face shield. So it's super intentional to be general and applicable to many situations. Our experts, they brought research in. This is a great thing about having like world-class people right on campus that you can ask for help. And they talked about approaching behavior change with an emphasis on training and habit forming. So you'll see a lot of that in our digital materials. Our signage materials are more awareness. But we're not just asking people to wear a face covering. We're sharing tips that will help make it a habit, like keeping an extra face covering in your bag, or hanging one on the doorknob so you can grab it on your way out the door.
Yeah, and I think that simplicity is certainly science-based, and
yes.
The healthy behaviors are science-based, and I think that's why what we're seeing is across Ames and even Story County, this idea of more and more organizations wanting to get involved. I know that you and I have been in meetings where other organizations have said, yeah, we can support this. And I just wanted to give a shout out to some of those organizations that we know are on board. We have been working with Ames Chamber of Commerce, Ames Convention and Visitors Bureau, the League of Women Voters, the Ames Community School District, Mary Greeley Medical Center, McFarland Clinic, Story County government also involved, North Grand Mall, Ames History Museum. I'm sure I'll forget one or two of them, but we'll get them up on the screen. And it's open. So I think what's so awesome about this whole program is that Iowa State is saying, hey, if you like the message, come on board.
There's really, I mean, it's kind of been unprecedented collaboration. And you don't have to recreate the wheel because we're all after the same thing here. We all just want people to be healthy and practice healthy behaviors. And these are science-based and practical. And there's really no need for everybody to, because I know everybody, you're probably doing 75 million different things, and there's no reason why you need to completely start from scratch. And you can just pick up and take the ball and keep running, to use a nice sports metaphor.
Yeah, well, the Cyclones Care message here at the City of Ames, and we're definitely putting it into play. We will be continuing to promote the message, and I tell people this is a marathon, not a sprint. This isn't a week message. This is a months long of following these healthy behaviors and doing what we can to flatten the curve to ensure that our local medical health care facilities can keep up and treat people who do get sick.
Absolutely. We had a little bit of it's funny that you use that analogy because we did have a sprint to get to the marathon to get this packaged and put together. And we're putting out new materials all the time, and I'm sure we'll be developing them as the semester goes on. So where we see a need, if we don't see people physical distancing, we're going to probably have to put some more information out on how to make that a better habit or how to better achieve that.
Great. Well, thank you. Thanks to our guest, Erin Rosacker with Iowa State University. Just a reminder that Ames Responds to COVID-19 is an opportunity for Ames residents to ask their pandemic-related questions. Is there something that you're curious about? Let us know. We'll put together another episode with the latest information. You can call us with your questions at our City of Ames hotline, 239-5670, or email us at covid19@cityofames.org. Finally, please remember we are living in rapidly changing times. The information we provide today is the most accurate we have, but it could change. Please continue to check reliable news sources for the latest information. The City of Ames has COVID-19 information on our website at cityofames.org, COVID-19. Thanks for watching.